My name is Diane Thornton, and I have sat with dying people for 30 years. Let me say that again, because I want you to understand what that means before I tell you what happened to me. 30 years, hospice nursing, people who are leaving, and the family standing on the other side of that leaving, and me in the middle, doing what I can to make the passage as gentle as possible. I have sat with hundreds of people in their final hours. I have held the hands of men and women who were 95 years old and ready. I have sat with people who were 50 and furious. I have watched people die in their own beds with their families around them, the way the books say it should be. And I have watched people die alone in a room at 3 a.m. with only me there. And I have tried to make both of those deaths feel like they mattered, because they did. What I want to tell you is this. Before August 3rd, 2023, I thought I knew what death was. I had watched it from close range for 3 decades. I had studied it, prepared for it, facilitated it, grieved alongside it. I had more experience with the end of human life than almost anyone you will ever meet. And still there were things I did not know. I found out what I did not know on August 3, 2023, when I was the one on the bed instead of beside it. It started with a UTI, which I mention because the embarrassing ordinariness of it still strikes me. Not a dramatic illness, not a diagnosis that carries weight. A urinary tract infection that I attributed to dehydration in the summer heat, and treated with what I had at home: cranberry juice, extra water, the particular stubbornness of a nurse who believes she can manage her own health. A hospice nurse who spent 30 years urging patients to take their symptoms seriously, and then did not take her own symptoms seriously. By August 2nd, I had a fever of 103. By the morning of August 3rd, I was shaking in bed, and my daughter Tamara was standing over me saying, "Mom, we are going." I was admitted to Carolina's Medical Center that afternoon with urosepsis. The infection had crossed into my bloodstream. I went into septic shock within 4 hours of admission. My blood pressure dropped to 60/40. My organs began to compensate in the way organs compensate when the body is fighting for its life. And then my heart stopped. 5 minutes and 44 seconds. My daughter Tamara was in the waiting room. My son Derek was driving from Atlanta. Neither of them was with me when it happened. I was alone in the room with the monitoring equipment and the IV poles, and then I was not in the room at all. I want to be very deliberate about the next part of this story, because I spent 30 years of my professional life forming conclusions about what dying is, and those conclusions were not entirely wrong, but they were incomplete in a specific and important way. And if you have ever been present for someone's death, or if you are anticipating being present for someone's death, or if you are afraid of your own death, I want to offer you the part that I was missing. The part I was missing is the most important part. In 30 years of hospice nursing, I observed something that every nurse who works in this setting eventually observes, and that most of us develop a clinical vocabulary for in order to maintain our professional composure. The patients who are actively dying, in the last hours, sometimes the last days, frequently begin to see people who are not in the room. They reach, they speak to someone at the foot of the bed. They say names of people who died decades before. We call this terminal lucidity or terminal restlessness, depending on the presentation. We have explanations for it. Neurological disinhibition, the release of stored memories under hypoxic stress, the brain pattern matching in its final activity. These explanations are functional. They help the family feel less frightened. They give nurses something to say. I believed these explanations. I taught them to newer nurses. I used them in family meetings. On August 3, 2023, I became one of the patients I had been explaining for 30 years. I left my body the way you step out of a door. I was in the bed, and then I was somewhere else. And the somewhere else was immediately and undeniably more real than the bed. I am going to say that again because I need you to hear it. The place I went to was more real than the bed. More real than this room I am sitting in. More real than anything I have ever experienced in 30 years of physical reality. The light did not have a source. That is the detail that stuck with me as a nurse, because I am trained to find sources. Every light in a clinical setting has a source. Overhead fluorescence, bedside lamps, the blue light of the monitors. The light in that place came from everywhere and had no source. The way understanding comes from somewhere inside you, without a specific origin point you can locate. And then I saw them, my patients. Not all of them. I was only there for 5 minutes and 44 seconds, and 3 decades of patience would have required considerably longer. But I saw enough. The first face I recognized belonged to a woman named Alice Hawkins, who had been in my care 8 years ago. She had died of ovarian cancer at 71. Her last days had been difficult. The pain management had been complex. Her family had struggled to agree on her care, and there had been nights when I had gone home doubting whether we had done everything we could. Alice had died on a Thursday morning with her daughter at her side. Alice was standing in that light looking completely, serenely herself. She was not the woman in the final weeks, not thin and gray and laboring. She was luminous and whole, and she looked at me with a recognition that said, "I know you. You were there when it mattered." I want to pause here and tell you what that meant to me as a hospice nurse. Because the thing that no one tells you about this work, the thing that sits in the chest at 3 a.m., is the doubt. The doubt about whether what we did was enough, whether the person suffered, whether they were afraid, whether they knew they were not alone. Seeing Alice looking like that, seeing what she looked like on the other side of what I had witnessed, that doubt dissolved. Not because I concluded we had done everything perfectly, but because I understood that what we were managing at the bedside was the body. and the person inside the body was not experiencing what the body was experiencing. This is the beautiful truth I promised you. The body struggles. The body labors. From outside, it can look like suffering. And there is genuine physical pain in dying that we work to address. I am not diminishing that, but the person, the consciousness, the self, the whatever it is that makes us who we are, that is already beginning to arrive somewhere else, long before the last breath. The reaching that I watched for 30 years, the speaking to people no one else could see, the sudden moments of alertness in patients who had been unconscious, the specific names called out to empty corners of the room. I understood in that light what all of it was. They were not hallucinating. They were arriving. They were seeing what I was seeing, the people who had come to be present at the crossing. My mother was there. Genevieve Thornton died 2010, heart disease. She had been a nurse too before me. She had been the reason I became a nurse. She was standing in that light, looking exactly like herself at 50 years old. And she said this in a very specific, very Genevieve way, which is to say without sentimentality, but with great firmness. Diane, you already know this. You have always known this. You just could not see it from where you were standing. She was right. All the times I had sat with a dying person and felt them leave before their body was done, that had been real. I had felt something change in the room that I could not explain clinically, a quality of presence shifting, something departing. I had put the feeling aside as unscientific. My mother, standing in that light in 2023, told me I had been right to feel it. I was sent back. There is no other way to describe it. Not by a voice or a command, by a pull, the specific pull of Tamara in the waiting room, and Derek driving on 85, and the faces of my grandchildren. I turned back toward them. I came back to the hospital room, and the flatline alarm, and the team beginning their response. I came back to the weight and the specific discomfort of a body that had been through something hard. I came back and I lay there with my eyes open, and the first thing I thought clearly was, I have to tell Tamara. Tamara was 26 when I got sick. She is my youngest, and she has always been the most anxious of my children, the one who worries. She had been sitting in that waiting room for 4 hours while her mother was in septic shock, and when the doctor came and told her I had coded and been resuscitated, she had not moved from the chair for another hour. I told her in the hospital room. I told her slowly and carefully, the way I would tell a family member of one of my patients, the things they needed to understand about what their loved one was experiencing. I told her what I saw and what I felt and what my mother said. Tamara is a practical young woman with no particular religious background. I raised my children in faith, but I did not force it, and she had drifted in the way that people drift. She sat with what I told her for a long time without speaking. Then she said, "So Grandma Genevieve is okay?" I said, "Grandma Genevieve is more than okay. She is herself at her best." She told me she has always known this, and she was waiting to be right about something this big. Tamara laughed. It was the right laugh for a moment that needed relief. I have been home for over a year. The urosepsis is resolved. I still take a daily antibiotic as a precaution, and I now take my own symptoms seriously, the way I should have been doing all along. I am no longer working. I retired on schedule in early 2024, 14 months after the event, but I spend time mentoring younger hospice nurses, which feels like the right thing to do with what I know. Before I get to that, I want to tell you about the week I came home from the hospital, because it says something about what changes and what does not. I came home on a Tuesday in August. Tamara had been staying at my house, and she had cleaned it top to bottom and stocked the refrigerator, which is what Tamara does when she loves you and does not know what else to do. The house smelled like lemon cleaning spray, and there was a card from Derek on the kitchen table that said, "Welcome home, Mom. We are glad you are still here." I sat in my kitchen for a long time that afternoon. I looked at the things I had accumulated in 30 years in that house. The photographs on the refrigerator, the particular angle of the late afternoon light through the back window, the coffee mug with the chipped handle that I have been meaning to throw away for a decade and never do. All of these things were the same. I was not. What was different was the weight. There is a weight that comes from 30 years of witnessing death from the bedside. Not a bad weight, not a traumatic weight, but a weight nonetheless. A cumulative heaviness from carrying all those endings. The bag that I had been loading, one departure at a time, for 3 decades. It was lighter. Not because the grief was gone. I still grieve the patients I have lost. But because I understood on the cellular level that only experience produces, that the endings were not what I had been watching. I had been watching doors, and the doors opened onto something I have now seen. What I tell them now is different from what I told them before August 3. Before, I told them, the body struggles. The process is hard to watch. Use your clinical skills to manage the symptoms and use your presence to support the family. That is true, and I still say it. But now I add something. I tell them, you will see things at the bedside that the clinical vocabulary does not fully cover. The reaching, the speaking to invisible presences, the sudden clarity. Do not explain it away entirely. Something is happening that we can see the edges of, but not the center. Trust it. The center is something beautiful. I want to say that directly to you if you have been present for someone's death, or if you are going to be. If you are afraid that the person you love will suffer, that they will be afraid, that they will be alone, I want you to hear this from someone who has been on both sides. The crossing is not what it looks like from outside. The body has its process, and yes, that process can be hard. But the person inside the body is accompanied. They are being met. The ones who have gone before them are there. The love that seemed to end when those people died, it did not end. It is present at every crossing. They are not alone. They have never been alone. If this message helps you, if it gives you something to hold on to as you sit beside someone you love, or as you think about your own crossing, please share it with someone who needs it. The link is right below this video. I spent 30 years trying to make dying less frightening by being present, by being skilled, by being calm when families needed calm. I gave what I had to give. Now I have more to give. Not clinical skill, testimony. The beautiful truth is this: dying is not an ending. From inside the experience, it is not darkness or silence or the absence of everything you loved. It is the opposite. It is fullness. It is arrival. It is the face of every person who loved you, waiting. I know because I went there. I know because I saw Alice Hawkins in her full light, healed and whole, grateful. I know because my mother told me with great satisfaction that she had been right. She was right. We are not ending. We are arriving. I want to add one more thing before I close. Something that I think is specifically important for the people who work in the spaces I have worked in. Nurses, doctors, social workers, chaplains, anyone who spends their professional life in proximity to death and carries that proximity home. We do this work because we are called to it. We do it because we believe it matters. We sit in the rooms that most people are too afraid to enter, and we try to make those rooms feel less frightening. And we hold the hands that need holding, and we say the words that are available to us. And we do it again the next day, and the day after that. We carry a weight that is not often spoken of, the weight of not knowing what is on the other side of the door we are standing beside, the weight of facilitating a transition whose destination is uncertain, of comforting families about a reality that we ourselves cannot verify. I am here to tell you, from the other side of a cardiac flatline, that the work is true. The comfort is not false. The destination is real, and it is beautiful, and the people who arrive there are well. Every hand you have held, every departure you have witnessed, every family you have sat with in the worst hour of their lives, the door opens onto light. I have been in the light, and every person I have ever guided toward that door has passed through it and found exactly what they were hoping for. Keep doing the work. You are carrying people toward something wonderful. And what we are arriving at is worth every hard day of the journey.